Well, Sierra Leone has called for international help to curb the spread of Mpox as the number of cases continues to rise. A week ago, there were 3,011 cases. At the weekend, over 300 new cases were announced. So far, 16 people have died from the outbreak. Mpox, which is related to smallpox, shows itself through a high fever and lesions on the skin. Other African countries have seen similar outbreaks, and last week the health authorities in the Democratic Republic of Congo recorded 182 new cases. Well, let's now speak to Dr. Jean Kaseya, who is the head of the Africa Center for Disease Control Prevention. He's joining us from Marrakesh in Morocco. Good morning to you, Dr. Kaseya, and welcome to the program. Give us a picture of what is happening and how widespread it's been for Sierra Leone with Mpox.
Yes, today Sierra Leone is seriously affected by Mpox, and last week we recorded in Africa more than 3,286 cases, and 74% of cases came from Sierra Leone. And we see in Sierra Leone this huge increase that is also affecting other countries like Togo and Ghana.
So what's behind this increase, this rise in the numbers of cases?
First, we need to talk about the weakness of the health system. It means the surveillance system is not what we could expect to see in Africa today. Second, we need to talk about lack of commodities, vaccines, medicines, and diagnostics, because we were unable to contain this outbreak in Sierra Leone due to lack of vaccines. And we need also to talk about health facilities that are overwhelmed today because the bed occupancy is more than 200%. All of these factors are explaining why we have this huge outbreak in Sierra Leone.
You talk of a weakness in health systems, you talk about lack of vaccines. So what kind of support is the CDC offering to these countries?
We are glad to say that we have dialogue with the high-level political authorities in Sierra Leone, and Africa CDC already deployed a number of epidemiologists and people with some other skills like laboratory and to support the community health program. We are also provide appropriate support for vaccines. We already sent some doses of vaccines in Sierra Leone, but it's not enough. We are looking for solutions to add because we received a request, additional request from the Ministry of Health. In addition to that, we are supporting the surveillance system, and we are also supporting the laboratory system. I think we are providing a comprehensive support to stop this outbreak in Sierra Leone.
Who are you having these conversations with about getting more vaccines?
At the global level, let me say that I had a meeting with the CEO of Gavi to discuss the Sierra Leone issue when I was in Geneva, and our teams are working together. We are also discussing with all other partners, with the even private sector, this company manufacturing the Mpox vaccine. I think we have a large range of partners discussing with us on the Mpox in Sierra Leone, but also other countries.
How soon do you hope to get those vaccines?
We already provided support on vaccines, but as you know, the epidemic is moving. We are in alert mode, and I think we are having dialogue with the ministry on the best way to deploy what they got, and we will continue on a weekly basis to update and to provide support if needed. But I want also to say it's not just Mpox today. We have now cholera killing more than Mpox. This is why on the 4th of June, we have a meeting with head of state in Africa to discuss the cholera issue, because that one is killing now more than 2,500 people in 2025.
Dr. Jean Kaseya, merci pour votre temps. That is the head of the Africa Center for Disease Control Prevention.